Uh, Okay, good morning everybody. So today we shall discuss about the care of the newborn. Oi, Lord let you. చూడండి 10 నిమిషాలు. ఏది Today we shall discuss about the care of the newborn, normal newborn. ఓయ్ రావట్లేదు. ఓయ్ స్క్రాల్ అవ్వట్లేదు. Okay. The definition of newborn is definition neonatal period or neonat or newborn. The first 28 days of life we call it as newborn. Perinatal period is 22 weeks of gestation to 7 days after birth. That is called perinatal period, from the 22 weeks of gestation to 7 days after birth. The neonat is divided into two. That is, one is early neonat, birth to first 7 days of life, and late neonat after 7 days to 28 days of life. So early neonat is birth to first 7 days, and next from 7 days onwards to 28 days is called the late neonat. We call it as a term baby when the baby is born after 37 completed weeks up to 42 completed weeks of gestation. We call it as preterm, the baby born before 37 completed weeks of gestation. You call it as preterm baby. And postterm baby, when the baby is born after 42 completed weeks of gestation. So, coming to your definitions, small for dates or small for gestation is the birth weight is less than 10% for gestational age, and appropriate for dates or appropriate gestational age when the birth weight is 10th to 19th centiles for gestational age, and large for dates or large gestational age, the birth weight is more than 19th percentile for gestational age. These are the small for dates, appropriate for dates, and large for dates babies. This is what the definitions are. To classify the newborn, depending upon the gestation is term baby, preterm baby, and postterm baby. As I had discussed, the term baby is 37 weeks to 42 weeks, 37 weeks to 42 weeks, and preterm any birth below 37 weeks, and postterm any birth more than 42 weeks. We call it as term, preterm, and postterm babies. Depending on the birth weight, normal birth weight is on an average 2,500 grams to 3,999 grams. And low birth weight is less than 2,500 grams or 2.5 kgs. Very low birth weight is less than 1,500 grams. That means 1.5 kgs. Extremely low birth weight, we call it as less than 1,000 grams. That means less than 1 kg. And preemie we call when the baby's weight is less than 750 grams. The micropreemie, when the birth weight is less than half kg or 500 grams, we call it as micropreemie. Very low birth weight baby means 1,000 to 1,500 grams. Very low birth weight, 1,000 to 1,500 grams. And extremely low birth weight, 500 to 1,000 grams. Depending upon the gestational age and birth weight, small fur dates, broad fur dates, and large fur dates. That is preterm, term, and postterm babies. Plotting the weight, length, and head circumference, we got a birth weight of 1,000 to 4,000. We have plotted a graph, and length of the baby we have plotted according to the gestational age, and the head circumference also we have plotted according to the gestational age. Component of newborn care. First, the delivery must be clean in a clean room, that is a clean delivery and clean cord care. Maintenance of body temperature, warm room, clothes, cap, socks, oil massage, we have to do. Coming to the skin care, sponge the baby, not to scrub vernix. Vernix is a small covering as soon as the baby is born. These are whitey flake-like things, what we call it as vernix. So that will protect the baby and maintains the temperature of the skin temperature. So we must sponge the baby, but not to scrub the vernix. And care of the umbilical stump. Keep dry. The umbilical cord falls 5 to 10 days after the delivery. Coming to the care of the eyes. Then breastfeeding. Must put on the breast feeding 1 to 2 hours after birth. And weight record is also to be maintained. And early diseases of serious diseases, early detection of serious diseases, and immunization has to be done to the baby. Then supplements and follow-up we'll discuss in detail. Follow-up is in well baby clinic and evaluation of the baby. The exclusive breastfeeding, growth and development, immunization, nutrition advice to be given to the baby. Basic care of the normal newborn is rooming in, receive the baby in sterile sheet, cover adequately, and dress the baby, and check color, respiration, temperature, and umbilical cord. Record skin temperature. Basic care of the normal newborn. Mother's role. What is the mother's role in basic care of the newborn? As instinct, concern, interest, love and affection for the baby can involve in nursing care and recognition of early evidence of the disease. Coming to the basic care of the newborn, mother's role is breastfeeding. First feed within 1 to 2 hours. No prelactial feeds. So before breastfeeding, you should not give any other feeds. So you must start the baby first with the breastfeeding and colostrum to feed. First, you get a yellow colored colostrum, which contains a lot of immunoglobulins, which protect the baby from the diseases, and that is called the colostrum to be fed to the baby. No need of water. Demand feeding every 2 to 3 hours or 15 to 20 minutes birth can be given. Adequacy of the breastfeeding to be seen. Care of the normal newborn. Maintenance of body temperature. Avoid bath on first day. Cover adequately and dress. Give bath at bath immediately after birth. Clean blood, mucus and meconium. Bath can be given on the next day. Use unmedicated soap and lukewarm water. Sponging is sufficient. Avoid dip bath. So you should not dip the baby in the basin of water or like that. So sponging is sufficient. Sponging the baby with a soft, smooth cloth with lukewarm water is enough. Skin care. No need to clean all over necks, but clean blood and meconium. Skin abrasions, use topical antibiotics. By delivery, there may be small skin abrasions. Use topical antibiotics if there are any abrasions. Care of the normal newborn. The cord care. Clamp, inspect 2 to 4 hourly for bleeding. No dressing is needed. Spirit cleaning of tip and around the base is essential for the cord. Dye care. Sterile cotton swab cleaning, each eye separately, no causal application. So vitamin K, 1 milligram IM within 2 hours of birth. While putting the dresses, dress must be loose, soft, preferably cotton, woolen and nappies are to be put. You should not put tough, tight and rough clothes. Should not be used to dress the baby. To care of the newborn, routine care. Term vigorous crying, pink in color and good tone, no meconium. Put on mother's chest, dry and cover with the dry linen. Skin to skin contact, clear airway must be maintained. If there is any mucus, you must suck the mucus and keep the throat clean for free respiration. And supportive care is warm to be maintained. Position, suction, dryness of the baby, and stimulate. Give oxygen if at all needed. Care during subsequent period is weight recording daily has to be done. Weight loss during first 2 to 3 days, 5 to 8% of body weight. Weight loss will be there due to when the baby is immediately born, there will be full of fluid, and once the skin will be wet and it becomes dry later. Because of that, there will be weight loss will be there. That is 5 to 8% of body weight. Then stationary for next 1 or 2 days. The weight will be stationary in the next 1 to 2 days. Regain birth weight at the end of first week. Average weight gain thereafter 30 grams per day. Immunization, BCG has to be given. Discharge plan and future visits to be explained at the time of discharge clearly. Grades of care of newborn. Level 1 care. More than 89% require minimal care. Weight more than 2000 grams require level 1 care. gestational maturity more than 37 weeks, and care provided at home, subcenter, and primary health care is enough. Level 2 care, 10 to 15% require this care. Weight of the baby more than 1500 grams, gestational maturity 32 to 36 weeks, and needs specialized neonatal care supervised by trained nurses or pediatrician. So, level 2 is needed when the weight of the baby is more than 1500 grams and gestational maturity is between 32 to 36 weeks. In these cases, babies need specialized neonatal care with oxygen, warmth, and in a incubator care. So equipment is ET, endotracheal tube and laryngoscope are noted. When the baby develops respiratory distress, these are essential to revive the baby. IV infusion, nasogastric tube, phototherapy. Facility for external transfusion must be available. Level 3 care, only 3 to 5% of the babies require this care. Intensive neonatal care, when the baby is less than 1500 grams, gestation age is less than 32 weeks. Skilled neonatologists, trained nurses are needed. Equipments, incubator, oxygen, suction apparatus, ventilator, infusion pump, and transcutaneous monitors are needed. Because here the baby is less than 1.5 kgs and gestation is less than 32 weeks, where the baby is premature. And the baby may require incubator and oxygen suction apparatus. The baby has to be put on ventilator whenever necessary. We must diagnose the serious diseases at an early stage, bleeding from any site, jaundice appearing less than 24 hours, within 24 hours, deep jaundice, physiological jaundice. We must do the test and depending on the bilirubin levels, we may have to subject the baby for external transfusion. So, when not past meconium within 24 hours, urine within 48 hours, these are to be detected early and treated early. Regurgitation, vomiting, loose stools are to be taken care and treated immediately. Poor feeding, lethargy, and excess sleepiness are to be taken care of, and you have to detect the cause for poor feeding, lethargy, and excessive sleepiness. So treat the baby accordingly. So similarly, we have to detect the serious diseases as early as possible, like excessive frothiness, drooling of saliva, cold to touch, fever, dehydration fever, and abdominal distension, difficult or rapid breathing, and convulsions are to be detected as early as possible and to be treated. Common neonatal problems are excessive crying. The excessive cry may be due to hunger, discomfort, full bladder, colicky pain, insect bites, and soiling of the diapers. The baby becomes restless and feels discomfort, and there will be excessive crying. In spite of having any colic, also the baby will have excessive crying. Then superficial infections like skin pustules, umbilical sepsis, conjunctivitis, oral thrush, they are to be treated immediately. When there are skin pustules, crystalline penicillin has to be given, and umbilical sepsis also. We have to dress the cord and clean the cord properly and put the baby on appropriate antibiotics. And conjunctivitis must give chloromycin applicabs or penicillin drops. Then oral trace, that is candidiasis, mostly due to candidiasis, you must do antifungal oral application of antifungal solutions. Blocked nasolacrimal duct. So when there is no blockage of nasolacrimal duct, there will be more of tears, repeated tears from the eyes. So you must detect the blocked nasolacrimal duct and treat it immediately. So minor development peculiarities are erythema toxicum, urticaria neonatorum, erythematous rash with central pallor, appears on second or third day in term baby, starts on face and spreads to trunk and extremities in 24 hours and disappears in 2 to 3 days. And you may find the peeling of skin and find out the reason for the peeling of skin and treat accordingly. Milia, retention of sebum, can occur and treat it. Mongolian blue spots may appear and diagnose and treat immediately. Minor development peculiarities like conjunctival hemorrhages, epithelial inclusions, and sucking callosities, sucking problem, and tongue tie. These are the various neonatal problems where to look into the cause and treat it. Hymenal tags are non-retractable prepuce. These are the genital abnormalities where we can treat the baby immediately. Prominent is the fistula or umbilical hernia. Umbilical hernia may be treated later, and you must see and diagnose any abnormalities in the neonat. Minor developmental peculiarities, disorders due to transplacental passage of hormones or mastitis neonatal. So breast will be bigger and infected, and due to estrogen withdrawal, the baby may have, if it's a female baby, there is more likely for the vaginal bleeding and mucoid vaginal secretions. Criteria for normal newborn. So we say that the baby is healthy when the gestational age is 37 to 42 completed weeks. Birth weight is 2,500 to 3,999 grams. Breathing is spontaneous, regular. Respiratory rate is 30 to 60 per minute. Color is pink, but slight peripheral cyanosis soon after the birth is seen. So these are all to be gathered together. We call it as Bishop's Apgar scoring. This Apgar scoring is, we shall see the breathing, heartbeat, color of the skin, and the muscle tone. All these will make it to have good Apgar score. The score must be 10. Any score below 8, the baby needs resuscitation or intervention of the trained nurse or the pediatrician. The heart rate must be 100 to 160 per minute. Temperature axial must be 97.5 to 99 degrees Fahrenheit. Then head circumference must be 33 to 35 centimeters. Length of the baby must be 50 centimeters. Chest circumference 3 centimeters less than head circumference. The upper segment and lower segment is 1.5 to 1.9 is to 1. Such soon of baby sucks the breast soon after birth. Sleeps 18 hours per day, and physiological photophobia and sclera is bluish. Ear cartilage is firm with good elastic recoil. Just feel the ear pinna. It will be firm with good elastic recoil. Breast nodules less than 5 millimeters. Liver palpable 2 centimeters. Genitalia genitalia, male testes in the scrotum, deeply pigmented scrotum, and adequate rugae must be there for the scrotum. In female, labia minora covered with labia majora, and soles more than anterior two-thirds show deep creases. The sole more than anterior two-thirds show deep creases, and criteria for the normal newborn is muscle tone increased by adults, standard attitude of flexion. The muscle tone must be good, and 95% term and preterm void within 24 hours, but some pass after 48 hours. The urine, the baby voids urine within 24 hours normally, but some pass the urine in 48 hours. 99% of term and 95% of preterm passes meconium within 24 to 48 hours of birth. No apparent congenital anomalies. So when you examine the newborn, examine region by region. Soon after birth, at 24 hours of life, and before discharge. Prerequisites are wash and dry hands, good light, warm environment, and consent to be taken, and examining of the newborn. Overall impression, face, we have to examine part by part. First face, then trunk, limbs, and activity of the fetus. Measurement of weight, length, and head circumference are to be taken. Color of the baby, whether it is a pink, is a good sign. If it's a jaundice, then you must make out whether it is a physiological jaundice or pathological jaundice, and you must investigate for the jaundice. And the skin color, pallor, jaundice, or erythema toxicum. Head frontalis, sutures, if there is any cephalomatoma, superficial injuries, then you must treat. Face, dysmorphic features, ears, low set or deformity of the ears, and eyes, discharge from the eyes, inflammation, any congenital cataract is there, you must see. Nose, conal atresia is there or not, you have to see. And mouth, cleft palate, macroglossia, microganthia, and excessive frothing are to be seen. And neck, sternomastoid tumor, brachial and thyroglossis, webbing neck, short neck, neonatal goiter, and cystic hygroma are to be seen in the neck. Upper limbs, if there is any Erb's palsy, and if there is any injury to the brachial plexus, the baby may, while delivering, mostly in breech presentation, when we deliver vaginally, there may be Erb's palsy and clumsy's palsy, and there may be extra digits. So there may be, instead of 5 fingers, there may be 6 fingers. So in the hand, they are called extra digits. And chest, accessory nipples, wide apart nipple, or breast hypertrophy, or lung fields are to be seen. Examine the abdomen for organomegaly, any enlarged liver. Normally 2 centimeters will be enlarged in neonatal period, and distension and bowel sounds are to be heard. Abdomen, umbilical cord, single umbilical artery may be seen, and signs of sepsis are to be seen. Hip, is there any congenital dislocation of the hip? And genitalia to be examined. Anus, imperforated anus. Is there, the bowel distension will be there, and the baby will not be passing urine. In imperforated anus, the baby will not pass motion, and the abdominal distension will be there. Then the baby has to be shown to the surgical neonatologist or pediatric surgeon for the treatment of imperforated anus. Feet, you must examine for club feet, sole creases, spine, midline defect, that is spina bifida, meningomyelocele, and primitive reflexes are to be examined. So spine, midline defect, spina bifida, and meningomyelocele, and primitive reflexes are to be seen. Thank you for your attention. Any questions you can ask? Any questions? You put it in the chat box. Any question regarding the care of the newborn? No questions? Thank you.